Hi everyone, I'm Sam Cortese. I'm a child and adolescent child psychiatrist, currently associate professor in psychology and medicine at the University of Southampton and consultant with Solent NHS Trust.
So Sam, behind you we've got a backdrop that says why choose an ACAM Masterclass? So why should people choose the ADHD Masterclass?
Sure, well, I have to say I ran several events on ADHD, several conferences and courses, and I have to say it's quite tricky to run them nowadays because practitioners in general nowadays have a good knowledge of the basics of ADHD in terms of diagnosis, differential diagnosis, the basics on the genetics and the neuroscience and the treatment. And so that many of them, when they attend general courses on ADHD, they may say at the end, well, actually, I didn't learn anything new. I was expecting more. So I would say that the masterclass on ADHD is definitely different from the other events on ADHD. The reason being is that it is addressed to those professionals who have already a basic knowledge, but they want to know more. They want to stay updated in terms of the latest evidence in terms of neuroscience, genetics, pathophysiology, treatment. And so this is really the purpose of this masterclass. It's run by Professor Edmund Sonuga-Bark, who is a well-known, internationally renowned neuroscientist and psychologist in ADHD, and by myself. And we cover two different aspects during the day. In the morning, usually Edmund covers the genetics and the neuroimaging, the neuroscience of ADHD. And I think he does this in an outstanding way. He's able to cover a series of complex topics just in one morning and to provide an update summary of the main research findings. And I think it's very important for practitioners to be aware of this, because some of my colleagues, for example, have still a kind of basic knowledge of this, and we may still think that the genetic of ADHD is related to a few genes, dopaminergic genes, for example, and the neuroimaging, the neuroscience is just characterized by alteration in a few areas. Now, over the last decade, this has really changed quite significantly. So it's really important to know what is our understanding currently, to discuss this with our patients, with their families, and to understand especially how this knowledge may inform or may not inform yet clinical practice. After this, in the afternoon, I usually cover the evidence base on the treatment for ADHD, including both the pharmacological and the non-pharmacological approaches. And once again, we try to cover the highest level of evidence, relying on very rigorously conducted meta-analysis in the field. And we try to also highlight to which extent this evidence base can inform clinical practice and decision making in daily clinical activity. And once again, it's important to appreciate that when we look at the high level of evidence, the level of information we have is quite different from just looking at just an individual study. So we try to provide really with delegates with a tool to understand better what science says to inform their clinical practice. And so we are pleased to see that the feedback has always been very good. The delegates from previous events rated the masterclass as good or very good in 100% of the cases. And this encouraged us to go ahead and to continuously update the program to offer the best product to delegates.